Let me back up and point out another problem that a lot of people in my district are having with this plan. 85% of Americans do have health insurance, and by and large, it's not a perfect system, but they're largely satisfied with the health care that they have. And so we have a relatively small number, not just 15%, it's actually smaller than that, because of that 15%, some of those people can't afford insurance, they're just paying bills as they go, they're self-insuring. Also, there are those who are qualified for existing programs, so they don't really need a new program for them. So you have it may be 5% or less of Americans that actually need health care. So why are we revamping 1/6 of our nation's economy, the entire healthcare system, for a small percentage, 5% or less of our population? The people in my district can't understand that.
I just have to stop you there, gentlemen. I think you put your finger on probably one of the biggest question marks going here. You know, and this is such a straightforward question, but I think it needs to be repeated. What we're saying is that 80% at least of Americans have some kind of health insurance. Most of them are reasonably pleased with the health insurance and the doctors they have and the delivery systems. So you've got 80% of the people that are okay with it, and yet you're going to basically take all of that and change it in order to take care of, what, 5 or 10, depending whether you count illegals or whatever.
Will the gentleman yield?
Yeah.
What it boils down to, if the problem really is those who are uninsured, who cannot afford it, we have a lot more targeted and focused ways of meeting that small percentage rather than revamping our entire healthcare system.
Gentlemen, I think you brought an exceptionally important point. Unfortunately, our hour has just flown by.